Hello, everyone. I am Orva Morales, and thank you for joining us during our fourth of five capacity building webinars titled Best Health Communication Practices to Evaluate Your Social Media Efforts, which will be presented by PGP's own CEO, Dr. Joe Smizer. This webinar will focus on how to interpret the performance of your social media activity, with an emphasis on measuring the efficacy of your health message. But first, quick housekeeping notes. We encourage you to post in the chat box your questions and comments, and we will get to them towards the end of the presentation. Also, please wait at the end of the presentation to take an exit poll for us that'll help inform us as we complete these capacity building webinars. And with that, I'm excited to introduce PGP's Chief Executive Officer, Dr. Joe Smizer, who has his PhD and Master's in Public Health with an emphasis in health communication, and did his postdoc at the U.S. Centers for Disease Control and Prevention through its Evaluation Fellowship. His career has been spent working in both the public and private sectors, designing behavior change programs and social marketing campaigns. He has had the privilege of designing the core strategies for several of the United States' largest behavior change campaigns. And with that, I am very excited to present to you Dr. Joe Smizer, who will lead today's webinar. Joe?
Great, thank you. Thank you, Orville, for that very nice introduction. Can everybody hear me all right?
Yep.
Okay, great. And can you see me?
Yes.
All right, perfect. The technology is working. Well, what we've set up for you today is a sort of pull back the curtain approach where we share with you some real metrics reports that we provide to funders and stakeholders for our campaigns. We use a pretty standardized approach when we provide these metrics reports. We provide them monthly, and the only work that PGP does, for those of you who are unfamiliar with us, is public health. And public health behavior change campaigns. So from our point of view, we are creating behavioral health interventions or community health interventions, and we're using communication as a tool of that intervention. So we evaluate all of our efforts in two parallel ways. We evaluate them as a media campaign. So we look for metrics that any media campaign would be collecting and evaluating. And then right next to and along with that, we're evaluating the campaign based on public health outcomes. Usually we do that through survey instruments. So we look for validated measures taken from public health research, and we create surveys where we establish a baseline before we do anything, and then a midpoint and an endpoint. And those questions are seeking to understand shifts in knowledge, attitudes, and behaviors around the particular health topic that the campaign is covering. I should also note that all of our campaigns are pretty targeted. Usually we're trying to reach a really specific population of people because a particular group of people over-indexes for risk for a particular health behavior or health outcome. So if we're looking at NJ Sugar-Freed, we already know from the public health literature as well as from market research which populations in the state of New Jersey over-index for purchasing of sugary beverages. And so we're trying to reach those populations with messages tailored specifically for them. We do large-scale sort of mass appeal campaigns more for a general audience, but I would say that those are the minority of the work that we do, because typically in public health, there's always some group of people that most needs to see a message. We tend to take an epidemiological approach to our designing of campaigns, and it's very rare where everyone needs to see the same thing. We usually are trying to make sure that every dollar that we spend, we're getting the most bang for the buck out of that dollar. And to us, bang for the buck means a behavioral outcome, a public health outcome. So with that said, The title of today's webinar is Best Health Communication Approaches for Social Media Campaigns. And you can see I've put best in quotations. That's because although everything you're going to see today is evidence-based, and sometimes that evidence comes from public health, and sometimes it comes from market research or industry, there are different approaches to doing this. But the goal of today, like I said, is to pull back the curtain and to show you all what's pretty hard to find. I would assume that those of you who are logged in today have had the same experience that I've had in my career. If you're trying to get your hands on metrics reports or any sort of actual data or actual evaluation of campaigns, much less behavior change campaigns, it's almost impossible. And that is because for-profit marketing and advertising agencies do the work of creating campaigns for public health, typically. And for-profit marketing and advertising agencies have no incentive to publish the results of their campaigns. In fact, there's a lot of reasons not to do that. One of which being you're giving competitive intelligence to all of the other agencies out there that are vying for the same RFPs from the same government agencies. PGP being a public health nonprofit, it's in our mandate to share what we do with the public sector. So that's why I'm able to share with you today some real metrics reports that are from real campaigns and that have actually been presented to funders and stakeholders. And I'm doing so with the permission of those funders and stakeholders. And that's because it feels a lot like this. If you work in public health communications, your job often feels like this. You don't have enough money for the thing that you need to do, the people that you need to reach, and the shifts that you're trying to create in knowledge, attitudes, and behaviors. And you're looking out your window, if you're lucky enough to have a window, and you're looking at all of the campaigns and marketing campaigns and social marketing campaigns that are out there in the cluttered marketplace that your campaign is active in. And you're very aware that those campaigns have more resources than you have. And as I said before, you're also very aware that you have a dearth of information that you're using to make your decisions with. You may have a master's in public health and health communication. You may even have a PhD in public health with a focus on health communication. In my case, I even have a postdoc in, in public health with an emphasis on health communication. And never once in any of my formal public health training was I presented a media metrics deck. I didn't know what they were, and I didn't know how to construct one or how to collect the data for one, much less how to present it to stakeholders. What would a stakeholder even be interested in? What does success really look like? Until I spent time in industry and I learned on the job. So part of what PGP does these days is attempt to take everything that we're collecting in our real day-to-day work, running these campaigns, and as much as we can, present them to people in the public sector and other stakeholders to sort of rise all boats at the same time. So with that said, I'm going to jump to some tangible examples, and I'm going to try and leave some time at the end of the webinar for questions, because I hope what you're about to see stimulates some thinking and prompts some questions. And I know it's the last week before we all go on our holiday vacations, but don't spare me. Go ahead and throw difficult questions at me. I want to make sure that you all get as much as you possibly can out of today. So what you're looking at here is an example of a mental health campaign. And I'm going to show you the campaigns first, so you get familiar with what the content is and the purpose of the campaign. And then I'm going to skip to the metrics decks, and we'll walk through the metrics decks together. You might be surprised if you haven't heard of this campaign that this is a mental health campaign, because if my screen share is working, you're looking at pictures of adorable pets. The purpose of this campaign, it's funded by Kaiser Permanente, is to reduce mental health stigma. And this is across 8 states and the District of Columbia. It's been running for over a year, and it has been formally evaluated and is currently undergoing peer review for publication in a public health scientific journal. If you look at the research around mental health and reducing stigma, there are 3 strategies that mental health researchers unanimously agree are important and most likely to lead to a reduction in stigma. And that's an education-based strategy, a contact-based strategy, and an advocacy-based strategy. So we had to create a way to get simple educational messages in front of the populations we were trying to reach in those 8 states. And we looked at the market research. So we knew the evidence-based facts that we needed to present people. Mental health researchers can, and if you do a review of peer-reviewed scientific literature on mental health, the facts, the evidence are very clear. You can easily generate a list of things that if people know them, they are less likely to hold stigmatizing views of individuals who live with mental health conditions. The challenge is not so much in knowing what to say, but how to say it. And we often run into this problem ourselves when we're trying to create a behavior change campaign. It's not as easy as putting a statistic up on a poster and putting it in a hallway. It's often much more complicated, and the complexity comes in, how do I get people to pay attention to my message? And how do I make sure that this message feels authentic and credible and resonates with people, where they pay attention and they don't disengage? So if you look at market research of the American public, and you look at what content does the best, what do people pay attention to the most and share among themselves the most, adorable pets is right up there at the top. And so that's why you're looking at what you're looking at. Is we had to figure out a vehicle for a mental health message. So every single day, a new pet is shared, and that pet is paired with a simple educational fact about mental health. And the facts come from the peer-reviewed literature, and the pet comes from actual pet owners. So people around the United States submit their pet to the Therapy Pets campaign, knowing that their pet is going to be paired with this educational fact. This has been going on for, like I said, a little over a year. We post every single day. Right now we have a holiday theme because we're coming up to the holidays. I'll scroll through this just a little bit. I won't belabor this campaign too much. I just wanted to get you familiar with what we're going to be talking about in the deck. You can see that we don't care what type of pet we're sharing. In fact, the more the merrier. We get all kinds of pets. We've had cows and horses and llamas and birds and, for some reason, a whole lot of lizards. And every single time you click on one, we have some copy here that's a little factoid about the pet and a little factoid about mental health, very light touch, and a link. A lot of these pets have their own Instagram accounts. And then hashtags relating to mental health, as well as hashtags to let people who are not interested in mental health stumble across the content. The other element of the campaign is a contact-based approach. So these are both sister campaigns laddering up to one single intervention, one single effort designed to reduce mental health stigma. So this other sister is called Like One Another. And Like One Another is a operationalization of a contact-based approach. And what a contact-based approach is, you show a human being who does not perceive themselves as having a condition, another human being who openly talks about having that condition, and you emphasize the shared humanity between the two people. So I am exposed to a person who says their name and that they live with X mental health condition, and then they tell me something else about them as a human being. And that's a really important point here, is with contact-based approaches that are designed to reduce stigma, you have to have that last little fact in there. You can't just say, my name's Joe and I've been diagnosed with PTSD. You have to end the statement with, and I'm a dad with 2 kids and I love to jog and my favorite food is pizza. Unless you add in that last little bit, then what the evidence shows is you increase the chasm between the person who doesn't have the condition and the person who does, because all you've talked about is how this person is different than me. So you have to find that commonality there. That's really important. So we get stories submitted to us every single day by people who live with mental health conditions, and they're openly talking about the fact that they have the condition, they live with it, but also other elements of their personality and their personhood to make them relatable to people who don't live with mental health conditions. So you can see here, as you scroll through, there's a lot of individual people's stories. Sometimes it's a photo, sometimes it's a video, but it goes out 7 days a week, just like Therapy Pets. And then finally, there's an advocacy-based approach. This is straight from the literature as well, but what this is allowing people to do is something. So you all are probably familiar with the need to have calls to action in every campaign that you're working on. A call to action is, what are you asking your audience to do? Sometimes it's as simple as learn more or visit this link, but with mental health, it's important to give someone a tangible thing to do so that when you've riled them up and you've gotten them excited about making a difference in the world about mental health, they have something to do. So that something to do in this example is you can sign up by text or email. They receive 2 pieces of original art a week. That art has a little mental health fact in it. And then they are asked to share one or both of those pieces of art with their social network. So it's a pretty light ask. It's a pretty simple ask, but people seem to like it. We get signups every week, and it allows people to feel like they're doing something simple, but something good. They're being a positive force out there in the world, especially the world of social media, which can feel dark and isolating at times, especially around mental health. So this is the campaign as a whole. It's Therapy Pets, it's Like One Another, and it's Mental Health Champions, this sign up and advocacy platform. Again, like I said, all of it is really one campaign, it's one intervention, and it's evaluated as a whole. So we collect media metrics on each element of this campaign, and we put it all together into a single PowerPoint that we provide to Kaiser Permanente, as well as to the stakeholders of Kaiser Permanente. We work with about 150 community-based organizations across those 8 states that I referenced that all help in some way with this campaign. So I'm going to skip now to those decks, and I'm going to walk you through what the deck actually looks like. And for those of you who have not spent time in marketing, when I say deck, deck is just another word for PowerPoint. But nobody says PowerPoint in industry, everybody says deck. Okay, so if you can see my title screen here, it's the whole effort, the whole intervention is called Action Minded, and this is our most recent metrics report. And all of the metrics you're going to be seeing for the most part are from social media, so it directly relates to what we're supposed to be covering today. So how we structure our decks is we start with an executive summary. And you'll have to pardon me because some of the information I'm going to be covering today is fairly basic, and then some of it is more advanced because I want to make sure that I cover all my bases. And I realize for some of you on the line today, this may be your first time looking at a marketing or media metrics deck, and others of you, you've looked at 100 of them. So I think there's going to be something in here for both of you, if you just bear with me. But often in my career, I've seen decks just start right away with charts and graphs without any narrative. And the narrative is really important because if you're giving it to a funder or if you have a boss, Usually they only have a few minutes of their day to understand how things are going, especially if you're presenting this every single month like we are. And so we start with this first page, which is if you don't have time to go through this whole deck, here's the gist. So this is the gist. Then we go into cumulative metrics. So just like we provided an executive summary at the beginning, which is words, now we're providing a cumulative metrics slide, which is numbers. So the whole thing taken together, here's where we're at. So you can see we're dividing it by year 1 and year 2, and then a total there at the last column. And we're looking at impressions, followers, engagements, and video views. Impressions are views. Impressions is another word for views. And there are 2 types of impressions: total impressions and unique impressions. For most of our clients, for most of our funders, for most of our stakeholders, they are predominantly interested in impressions, not unique impressions. So the difference between the two is if I tell you that the impressions is 10, that's helpful. If I tell you that those 10 impressions were created by 2 people, that could be more helpful to you. So 2 people, one of them might have looked at the thing 8 times and one of them looked at it twice, and my total impressions are 10, whereas my unique impressions are 2 people, 8 and 2. Generally though, we're just looking at overall impressions. Generally speaking, that's what most people are interested in. Followers, I think probably everybody on the phone is familiar with this. Followers is synonymous with fans. These are people who actually have followed your social media accounts, your campaign accounts, who are staying tuned, and they want to see all the content that you post. Engagements mean a like, a share, a follow. That's when somebody does something with your content. So they've engaged with it in some way. It is different than impressions. Impressions is just, I've seen it. Engagements is, I've done something with it. So engagements often mean more than impressions because you can passively look at something. If you've done anything with it, it took a little bit more willpower, and it's probably more likely that it's stuck in your brain. And then video views is what it sounds like. We post videos on almost all of our campaigns, and we're interested in specifically the views of these videos as opposed to impressions as a whole. So now we're going to start with therapy pets, and we're just looking at the month of November. So this is how we organize these slides. We organize the slides to show the impressions that we got for the month, the engagements that we got for the month, our average video views, our total video views. You can see this is blank because we didn't post any videos in November. But again, we're using a standardized template. So don't change your templates just because you don't have data. Try and use the same template over and over and over and over and over again. And if you don't have data, just leave a square blank. And then our total followers. So the followers that we've accrued in the last month. And then you'll see the percentages next to those. Those are relative to the month previous. So we're comparing November to the month before November, and we're showing what went up and what went down. And fluctuations are incredibly common, and that's part of why you pay people to do this, is someone has to be paying attention, someone has to be at the wheel and see what's working and what isn't, and adapting on the fly. We also like to show our top performing post. So for November, it was this adorable black little puppy, and there's a little you can see there's a little factoid about black dogs and about mental health, and you can see the metrics relating to this one post: reach, reactions, post clicks, and engagement. Reach is the total number of people reached by the post. So this is different than impressions. Remember, impressions are views. Reach is, this is how many people I reached with the post. It's literally reach. So 6.6 thousand people were reached by this post. This is one of the powers of social media, is we didn't have to pay for all of that reach. We didn't have to pay for all of these impressions. If you get enough people to engage with your content, the algorithms of every single social media site will take over, and you will start having people who don't follow your campaign, who wouldn't have seen your content, see your content because someone in their social network has engaged with it. So that's another reason why engagements are so important. And finally, you'll see on this top performing post, engagement percentage. You see that 17.2% there. So what that means is, of people who saw this post of the black puppy, 17% of them did something with it, which is really high. Now, I'm going to continue on to like one another. So you remember, this is the contact-based approach. So we've used the same template here. We have impressions, engagements, video views, and followers. You can see for the month of November, we did post videos for like one another. And so we have the video views total and the video views average. And you can see we've got a little bit less views than the previous month, but that's okay because we had more impressions overall and more followers overall. Like I said, every month is a roller coaster. And then we have, what we've done here is we want to help the stakeholders who are receiving this report understand the context of what they're looking at. So we've put in some comments that we've received on posts. So these are just screenshots on the far right, and we're just providing them to give a sense of what the conversation is like in the community of people who follow this particular campaign. And finally, mental health champions. So you remember, this is the advocacy based. This is a different kind of animal, pun intended. It's a website that people are driven to, and they sign up via text or email. So the metrics that we're reporting on for this element of the overall campaign are different than they are for like one another or therapy pets, because we're most interested in subscribers. This is basically a subscription-based campaign. Just like you would be trying to drive people to sign up for an email newsletter, this is very similar. So we're looking at our total subscribers. We got 635 subscribers in the month of November. New subscribers is 183. Total, we have 635. We have an open rate because we've got emails going out once a week informing people that there's new content to share. Our open rate is about 23%. The industry standard is 10%. So we feel like we're doing a good job there. And then we have website sessions where we are driving people, we're driving traffic to our website, and we've had 737 visits to the website in the month of November. So you can see this is a growing element of the campaign. It has different parts, and the metrics that we're reporting on are specific to the parts. Every part that has data attached to it of your campaign should have a row somewhere in a chart, somewhere in your deck. So that's it. Normally, like these decks can get really, really complicated. And I've certainly, I won't call out any particular federal agencies, but certainly during my time at FDA and CDC, I sat through very long decks, and there can be very good reasons for that. Perhaps you want to dig in, get really granular on a particular element of the campaign, a particular metric that's been collected, and you want to really understand. Okay, well, you showed me the top performing post. Show me the top 3 performing posts and the bottom 3 performing posts, and let's really dig into why we thought those 3 performed best and those 3 performed worse. All of that is valuable. What isn't valuable is creating decks with a lot of information in them for no reason. People hate PowerPoints. There's a reason the phrase is death by PowerPoint. It's a real thing. It's a crisis. We try and keep our decks pretty small, just the facts. And then if someone wants to dig deeper, we'll go in and we'll add in a particular, we'll answer a particular question in the deck, or we'll provide an addendum or an appendix to a deck. But try and just have the information that is actually actionable in a deck. Otherwise, you're just creating a self-fulfilling cycle of a miserable intern or health communications professional who is pulling numbers with no idea what these numbers are going to be used for. It makes you look like you're busy, but it doesn't do anybody any good. So I'll stop here and I want to show one more element. This is Stop Flu. So Stop Flu is an entirely different type of campaign, and this is intentional. I want to show you different types of campaigns so that you can get familiar with the different sorts of metrics that you collect with these campaigns. These are all social media campaigns. They're all completely relying on social media, but they use social media in different ways. All of you have heard about social media influencers. This is a big deal. It's not a buzzword, and it's not something that's going to be a flash in the pan, and 2 years from now, no one's going to care about influencers anymore. Influencers are here, and they're here to stay. And for evidence of that, you can go to literally any digital marketing conference. So every single brand in the world is investing a tremendous amount of money and time into understanding this new media landscape that we all exist in. And one of the things that they're trying to understand are the role of individuals who are themselves their own channels. This applies to public health and the public sector tremendously, because unlike Coca-Cola or Volvo, every topic that we work on is already touching people's lives. We only work on topics that are actually important. So we get money to do things because those things are impacting people's livelihoods. We shouldn't have to work very hard to get people to care about the topics that we're working on. Unlike Coca-Cola and Volvo, no one actually cares about Coca-Cola and no one actually cares about Volvo. The only reason we do is because we're hit over the head several times a day with marketing and advertising, forcing us to care. So the role of influencers is getting people who already resonate with particular populations that the campaign is trying to reach to be channels of information to the people that they already reach. So these are not necessarily spokespeople for a campaign. These are not people who are going to stand on a stage and as themselves represent a tobacco control campaign or a low birth weight campaign. These are people who have utility to health departments or public health efforts because because let's say you want to reach teenagers who are low income, who live in the state of New Jersey. Using marketing tools, you can actually identify the people you're trying to reach, pay attention to. PGP has a suite of these tools. We pay for them, but they're not prohibitively expensive, and they're getting cheaper every day because more and more people are beginning to use influencers every day. So how it actually works is we find people who the people we're trying to reach already pay attention to. We vet them. So we're looking for any red flags. If they pass vetting, we reach out to them and we ask them, would you be willing to take part in a campaign for X topic? Almost all the time they say yes. And then we give them some evidence-based messaging that they say in their own voice at a certain frequency over a certain period of time. So the example you're looking at right now is a campaign called Stop Flu. And you may or may not have heard of Stop Flu. The strategy behind Stop Flu is if you look at CDC data on flu vaccination rates across the United States, African American and Latinx communities have lower vaccination rates than other communities. And that is because if you talk to a public health person, of which I am one, they will often say, these communities are hard to reach communities. If you've heard me speak before, you know that I categorically reject that phrasing because that puts the onus on the community, because why are they so hard to reach? If they were only easier to reach, we would be able to help them. But The only communities that are actually hard to reach are ones who live in remote areas of the Amazon or on top of a mountain that a gondola is the only ability to access. Most communities in the United States are just living their lives, and it's on public health to figure out ways to reach them if the ways we've employed in the past are not effective. So this is an example of a way to reach communities in using a different approach than we've used in the past. So the way here is exactly what I just described. We have the zip codes in certain states where we know the people we're trying to reach live, and using market research tools or digital marketing tools, we know the social media influencers who resonate with those populations we're trying to reach in those specific zip codes. You can actually get that granular. You couldn't 10 years ago, but today you can do that. And this is what Coca-Cola and Volvo and every Fortune 500 brand does every day. So we just do the exact same thing. So at this moment, we have dozens of influencers who are sharing messages about getting the flu shot, getting vaccinated for flu. But they're doing it in their own voice and their own way, and relating it to who they are as a person. They are not copy pasting a public health message. And I'm going to show you some examples of that. What they do is they drive people to go to this website called Stop Flu. And if they're a Kaiser Permanente member, they click here. If they're not, they click here. And when you click one of those options, you see where in your area you can go get vaccinated for flu. Here are some examples of the influencers that we're talking about. These aren't particularly famous people. These are people, like I said, who are influential, usually in their own community, at most their own state. And that's because if you look at public health research, you will find that individuals who are influential within a smaller social network are more likely to be viewed as peers in that social network. So unlike Beyonce, who is nobody's peer, these people are influential in their city where they live. People might actually know them. People might actually pass them on the street. And when they say something, people are likely to listen because of all of the evidence that we know in community health about a peer is more likely to impact you than someone who you don't regard as a peer, as a friend, a neighbor, a coworker, and so on. So these are some examples. And if you go to Instagram and they all use the same hashtag, Stop Flu, you'll see some examples. So all of these are our influencers, and you can see they post what they want to post. So we give them some prompts. We tell them, here's an evidence-based factoid to choose from. The factoids change as flu season changes. So any of you who have worked on flu campaigns know that at the beginning of the season, you're trying to convince people desperately that flu matters, that flu is serious. At the peak of flu season, you have a different message. When flu season dips, you have a different message. So the messaging that the influencers are sharing reflects what we know from research about seasonal flu. I'm going to jump now to the deck. So here's our metrics report. This is from last month. So this report's a little bit different. We have a different group of stakeholders, and they like their templates in a slightly different manner. So we've got the goal of the campaign, the objectives of the campaign, and the campaign period. The reason this is different than the last deck is we have a massive flu working group who are our stakeholders here for this particular campaign. And so not everyone remembers why we're on a call when we're on a call once a month. You have an executive summary. So just exactly like before, we've got, here's the gist of what we've done in the month of November, in case you don't have time. Then we go into very similar slides as before, except this deck is almost entirely focused on metrics that relate to influencers rather than posts, like the last deck. So you can see we've had 82 influencers engage with the campaign so far. They've posted 216 times. That's resulted in about 50,000 engagements and about 919,000 impressions. If you weren't convinced about the utility of influencers in public health, hopefully this tips you to the other side of the fence. They are well worth engaging with. We also have different states. Like I mentioned, we have 8 states that this campaign is active within. This is a breakdown of the number of influencers per state. So if you were doing an influencer campaign in New Jersey, how I would do it would be, I would divide up the different geographies of New Jersey rather than by state. And I would say, here's how many influencers we have in each region of the state. Because we all know New Jersey is, everyone associates with being from New Jersey, but once that's out of the way, South New Jersey is very different than North New Jersey, and East is very different than West. Influencers by the numbers. So we can see this is just specific to November. So we've got total influencers, we've got 16. This is how many engagements they've gotten, about 6.7 thousand. Total networks, the number of social media sites that they're active on. They've posted 45 times. That got this many impressions. They have this many followers combined between them. They've got this many likes, comments, the reach of their stories, and the number of reshares. Stories are particular to certain social media sites. So for example, on Instagram, you can make a post or you can make a story. And a story is like a little video of that you make, and that's what this means. So the influencers that decided to post stories on Instagram got about 7.6 thousand views, or reached 7.6 thousand people with their story. And that story was shared 73 times. And you can see here, we've got the number of those influencers active on Instagram, Facebook, or Twitter, the number of posts, their respective followers, et cetera, et cetera. And then the number of influencers per state, again, just for the month of November. What you're looking at here is sort of a marketing funnel. So this is specific to the path that we want someone to take, because remember, the call to action is to go to a website for this campaign, unlike the other campaigns. So we're trying to drive people to go to stopflu.org. So every time an influencer says anything about getting a flu shot or vaccinated for flu, they ask the people that follow them to go to stopflu.org, where they will learn more and find a place to get their local flu shot or spray. And so you can see here, we've just tried to make it easy for the person going through the deck. 5,600 visits, 169 clicks on the button for KP members, 386 clicks on the button for the non-KP members, and then sort of where that goes. So if you're not a KP member, you go to Vaccine Locator, there's 489 clicks there. And we've given a little bit of information about what does that actually mean. What you're looking at here, there's many ways to do this, but I would encourage you to use shapes. The human eye gets fatigued very quickly if it's just, if it's a deck full of words or charts and figures and graphs. So the more you can break down complex ideas or strategies into kindergarten shapes, the easier it is for people to understand what you're saying. We've provided the top influencers by engagement here. So you've got, you could say these are top posts as well, but we've put the person's name, a little bit of some metrics relating to the person, and some examples of people engaging with them. And then some feedback and responses on social media. So these are representative of the general sense that we receive from the followers of these influencers. And so these are just screenshots. And the only reason this is in here is we're just trying to help the working group, who is responsible for a lot more than this campaign, to understand, here's what's going on. Everything's okay. The world's not on fire. It's all working out. We think this is going to work. And here's a sense of what we're seeing. The last thing I'll add here is We hear a lot about anti-vaccination and vaccine misinformation. It is an enormous problem. For any of you who work for health departments, anytime you're posting anything about vaccines, I am sure that you are getting a very friendly, warm response, right? No, it's miserable. They're very well organized, and they follow hashtags, and they're looking for fights. But we all just saw what happened in the news today in New Jersey. What's been interesting about this particular campaign, just as a quick anecdote, is if you have people who are viewed as authentic and credible by the people you're trying to reach, advocate for getting the flu shot, overwhelmingly, the response that they receive is positive. They are not getting spammed by people who are against vaccination or who believe in government conspiracies. They are getting a lot of thank yous from the people who already follow them. And that's why, that's another reason why I'm a big advocate for trying to work with influencers. Because in this current climate where everyone is anti-government and anti-science, influencers are a different way to reach the people that we still need to reach. So I'm going to, that's the end of this portion of the presentation. I'm going to stop here for questions on what I've already discussed, and then if there's more time, I'm going to share a little bit more. But I want to make sure that we have the time to answer questions first.
Hey, Joe, you want to open up the group chat? Because we have a couple questions from folks who typed their questions in the chat.
Okay. And I'm going to put my contact info large here, just in case you all don't have it. Okay.
And we do have a good 12 minutes left.
Okay.
We have to close, so we have a little bit of time to at least answer some of these questions.
Literally.
Okay, so where would you get impressions from? And I hope you don't mind that everyone can probably see my screen right now. Should I not do this? Is it?
I can read them for you if you like. Though you might have gotten some private messages as well.
Okay, let's do it that way. Just I want to be sure nobody gets unintentionally called out.
Straddling two different worlds. There's a little bit of an insecurity.
Oh, we have someone who might have to close their mute. Alrighty. So first question I'm seeing here is that Lauren is working on a hunger coalition, and they're working to create a social media campaign. Is there any advice you can give to attract the doers? Maybe she meant donors. She has people coming to the meetings, but they want to make action a little bit more mandatory for members. My guess is that get their members to be more active on social media. Any advice in that space?
Well, what I'll say is I don't like giving fake responses. So your challenge is a real one, and it's not a simple answer. So I don't want to pretend like I could in 10 seconds, give you an insight that would change your world. We tend to work for quite a while, sitting down with a partner and trying to deeply understand all of the challenges, and then working with them to come up with a strategy that we think would be effective. But what I can say is that challenge is not unique. And one trap, I think, that it's very easy to fall into, and this is not true of just the public sector, it's true of everybody who's on social media, every organization, is we have been taught that all of the information needs to come from channels that we own. So our social media sites that we own, our Facebook page, our Twitter account, our Instagram account, is the only way that someone could get information from us. And that followers are super, super important. They're the most important thing. Is we need everybody to follow us so they see every post that we make. Or we need everybody to sign up for our newsletter. That is not untrue. Those are important. But if you think about the work of community health, and that community health is built off of a collective impact model, which is there is a network of community-based organizations and individuals who you work with every day, who are all engaged in the topic and who all have their own channels and their own influence with particular populations. I have found it to be much more helpful to create a working group of the decision makers, the people in charge of communication across that entire group of stakeholders, to get them into a room and to agree upon a common agenda, to agree upon here is what we're all going to say and when we're going to say it and what we're going to ask people to do. And that often is a lot more effective than trying to find extra dollars to boost a particular post or to completely revamp your social media strategy. Sometimes those things are necessary and they're important. We could all be doing a better job at any given time on any campaign we're working on. But if you can actually get all the people you talk to regularly anyway, to all do a thing together for that collective impact, you tend to get more bang for your buck, more impact for the time that you have, which is limited. That also can be an area where influencers can be extraordinarily helpful. Is you have people who live in your community who are influential for whatever reason, and getting them at the table too can be very helpful. So I guess the last thing I'll say is open up your definition of what a stakeholder is. So if it's a food pantry or a food insecurity program, oftentimes what I have seen is the people who are engaged are knowledgeable about the topic, which makes sense. But including that second ring of people who are influential, only because they reach the people you're trying to reach, a barber, auto shop mechanic, someone who's a beauty blogger, doesn't matter. The only thing you're looking for is, are they reaching the population I'm trying to reach? And bringing them into the fold and opening up the doors and trusting them to also be methods of communication usually has a substantial impact, a real impact, a measurable one. I realize that is not doing your challenge any justice. It would take a lot longer to really understand what you're faced with, and you have an important program, and so I want to treat it with the respect that it deserves. But just off the cuff, that's generally where the conversation starts with us: is can we do something that doesn't involve more money?
Okay, thank you, Joe. And I have 3 questions that I'll ask, and kind of piggybacking off of that response. Would you say that that's a similar strategy, what you consider when you want people to use the same hashtag?
Hashtags are really challenging. So hashtags are, most hashtags happen organically. It's just a lot of people start talking about the same thing because the thing is interesting. And they need a way to organize all that commentary. And so a hashtag is created. Marketing campaigns from industry use hashtags because they have a lot of money. And so they pay to force the use of a hashtag. They can flood the airwaves with that hashtag and hope that because they have enough money behind it, people will start using the hashtag and the hashtag will get legs. And they won't need to keep feeding it, artificially propping it up. Usually public health doesn't have a lot of money. And so a hashtag is only valuable in certain contexts. A conference hashtag is helpful because it's all the people who are talking about the conference anyway. And so you can sort by the hashtag. Including a hashtag in a media campaign is always kind of a mixed bag, especially if it's a hashtag for an audience that is not an audience that you are trying desperately to get interested in your campaign. you're giving yourself a uphill battle, because if it's a campaign that is already has the challenge of getting an at-risk population to pay attention to it, then you're doubling the burden on yourself by saying, not only am I going to try and get you to pay attention to this thing that you don't want to pay attention to, that you have every reason not to pay attention to or not to see, but I'm also going to give you a hashtag that I want you to use. So it's a big ask. And that's why, hashtags are kind of hit or miss with the public sector. Sometimes you just have to use one, but I would say, there's a reason in the decks that I showed you today that you don't see numbers related to hashtags. And that's because I don't care if anyone uses the hashtag therapy pets or the hashtag like one another. What is that doing for me? Nothing. What I want is, are people engaging with the campaign? Is the message resonating with them? Am I keeping people from disengaging? And then is the performance of the campaign in every other way doing well? And in my surveys, are my surveys showing that there is a shift in knowledge, attitudes, and behavior around stigma? At the end of the day, that's why we're all here. I don't really care if, people remember the hashtag about the campaign. It has no impact on me. So I think this is an example of sometimes, not all the time, but sometimes we look for what industry is doing and we forget that the tobacco industry, for example, spends $180 million a year in New Jersey alone. And, and then we're often playing catch up. So I'm not saying don't make one. I'm just saying the emphasis on that as a measurement tool, it sort of depends.
Okay. Thank you, Joe. And to close out with this last question, kind of piggybacking off of that, is an understanding that you really made the point that working with local influencers is a great approach to ensuring that your campaign is resonating with the people you want it to resonate with. But is there a standard protocol in vetting local influencers? Because one would guess that just any individual who has a following might not be the best person to represent what we want them to. So any kind of standard protocol related to that you could elaborate on? And then if you don't mind, just kind of giving the last kind of closing statement so we can close the webinar.
Yeah, I would say don't blunder into it. So there are agencies that make a lot of money locating, vetting, and recruiting influencers for industry, for brands. And the reason they make a lot of money is it's hard work. But you can go to trainings where you can learn about influencer marketing. You can watch webinars that are specific to influencer marketing. You can read books on it. They even have classes now. So do your homework. Just as you would never recommend someone just deciding to start doing the work of an epidemiologist, the same thing is true of a field of marketing that is influencer marketing. There are professionals who have MBAs with a focus on influencer marketing. This is what they do every day. And it would be incorrect to assume you could just jump into it. That being said, with a few trainings, you can get away with a lot by being a public sector organization who is honestly just trying to help. And people aren't going to be mean to you or overly judge you if you make a few, noob mistakes when you're trying, when you're just starting to reach out. So it's more worth doing it than it isn't, is my 2 cents. And for the vetting criteria, yes, I can send that to you all. What we do though is we go back 6 months through the person's public profiles, all of them. So we go through all posts that they have made over all of their social media profiles for 6 months. And we're looking for a list of red flags. And that can include excessive use of profanity, extreme political views, sexual content, violent content, promotion of tobacco and alcohol and guns. We're looking for the criteria like that. And then once we find individuals who have not posted that kind of stuff, then we reach out. And the last tip I'll give you there is no one knows public health exists, and no one really cares about any of the topics we work on. So they care, but they don't know what we do. So they might have an uncle that died from lung cancer, and they might know someone who's overdosed from opioids. They don't know that there's a public health department working on that, and they don't know the definition of the word opioid, and they've never heard of tobacco control. And they think vaping is cool. So the challenge is that first outreach that you make to an influencer, it's just person to person. And what we have found works very well for us is we say, hey, we're a nonprofit. We're trying to do a social good campaign. We're in your community or in your state. And we really like what you do on social media. And we know a lot of teens follow you, for example. Could we tell you more about what we do? We're interested in asking you to help. And then like the sixth thing we say, like way down the road, we introduce this person to the concept of the particular topic we're working on, like tobacco control or vaping. If you start the conversation with, hey, we have a opioid campaign and we need, blah, 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 then they're going, what's opioids? What is this campaign? No. But everybody wants to help. So just give them a way to help. And then that opens the door. You can start the conversation. And then they're going to be willing to have you explain what public health is. So I'll go ahead and stop there. And then what I will say, though, is I know we didn't have a chance to answer all of our questions, but we have a record now. And so I will go ahead and write up my answers, and if necessary, give additional materials. And then Orville has graciously offered to share that out with the group. So we'll actually try and get to all of your questions.
Wonderful. Thank you so very much, Joe. We appreciate your time, especially because you're doing this work throughout the whole country. So the fact that you're not in the airport right now doing this. So I'm really grateful that you had a little bit of time to share your expertise. As Joe mentioned, we will be sending follow-up information around this particular webinar. A link of the recording of the webinar so you can sit through, as well as share the webinar with your colleagues. Feel free to shoot Joe an email on any other questions you may have, but we do have a record of the current group chat, and we will follow up accordingly. Again, the importance of communicating to the populations we serve cannot be overstated. So, we really hope that this was helpful for you. Please hold for a moment for our exit poll, and of course, drive safely out there because it's pretty nasty out here in New Jersey. So please